Hello everyone, this is EBP Group 1, and we're here to discuss brace treatment in adolescents with scoliosis. Let's get started. We decided to research bracing and its effectiveness for patients with adolescent idiopathic scoliosis. Maruyama, Grivas, and Kasparis found that bracing is a recommended treatment, at least for female patients with a Cobb angle of 25 to 35 degrees, and is more effective compared to other conservative treatments, such as electrical stimulation and other treatments like that. Clinical practice guidelines recommend using brace treatment for patients with Cobb angles above 20 plus or minus 5 degrees. The quality of evidence for the given recommendation is 3, and the classification of recommendation is B. Level 3 entails that multiple controlled non-randomized studies or systematic reviews of such studies were done. Multiple cross-sectional studies with incomplete and unbalanced verification with reference were done. This information was found on Table 1 of the appendix. A B rating entails that the recommendation is important but not applicable to all patients with a specific need. The clinical practice guideline is consistent with their systematic review because the guideline recommends the use of brace treatment with a Cobb angle greater than 20 or plus or minus 5 degrees, and the systematic review recommends the use of brace treatment, at least for females with a Cobb angle of 25 to 35 degrees. We appraised the clinical practice guideline using the Agree To score sheet. The overall objectives of the guideline are described in the scope, purpose, and application section. The objective is to offer all professionals engaged in the conservative treatment of scoliosis an evidence-based updated review of actual evidence in the field and provide a series of evidence-based recommendations. We gave this a 5 rating because objectives are provided, but not specifically described. The clinical questions are clearly stated in the scope, purpose, and application section. We gave this a 7 because the questions are specifically formulated. This guideline is applied to all idiopathic scoliosis patients regardless of age. We gave this a 7 because it clearly states the target population. This guideline development group is composed of many different individuals, including specialty physicians, allied health professionals, methodologists, and a patient representative have been included as well. We rated this a 7 because we strongly agree that the development group included all of the necessary professionals. The views and thoughts of the target population have been sought. It is stated patients have been involved in the development of the guidelines through the U.S. National Scoliosis Foundation, representing 25,000 actual scoliosis patients. It was also stated earlier that a patient representative was included in the development group. As a result, we rated this a 7. The target users of the guideline are clearly defined and are meant to be all professionals involved in the conservative treatment of scoliosis. However, it can also be used to serve as a reference for patients with scoliosis. As a result, we rated this a 7. Systematic methods were used to search for evidence on scoliosis. Medline was searched for the inception and no language limitation were used. They also used abstracts of all SOSORT meetings. We gave this section a 6 because they did also use personal files and knowledge from all of the authors listed. The criteria for selecting the evidence clearly described. The criteria are pertinence for the topic, brace treatment, presence of the abstract, numerical results in relation to scoliosis, retrieval in full text, and all languages. We gave this section a 6 because it did have the criteria in the guideline, but the ease in finding them was a little difficult. The strengths and limitations of the body of evidence are clearly described. The CPG asked the members to propose changes to the strength of evidence, Table 1, and it was listed in the appendix. As a result, we rated this 7. The methods for formulating the recommendations are clearly described in the document. There were a total of 65 recommendations. Recommendations were in the following topics: bracing, PSC to prevent scoliosis progression during growth, PSC during brace treatment and surgical therapy, other conservative treatments, respiratory functions and exercises, sports activities, and assessment. The methods are used are listed in each individual recommendation section. As a result, we gave this a 7 because it is very specific and is included individually. The health benefits of recommendations have been covered in the recommendations section, but the side effects and risks involved are not included. As a result, we rated this 2 because it is essential to include the negative effects of recommendations. There's an explicit link between the recommendations and evidence. Each recommendation was made based off of supporting evidence, and each member had to vote if they fully agreed, did not agree totally but could still accept, or if they could not accept the recommendation at all. We rated this a 6 because they allowed the member to vote in order to determine if the recommendations are in accordance with evidence. This guideline has been externally reviewed by experts prior to its publication. The final documents, recommendations, and practical approach flowcharts have been developed according to the Delphi procedure, carefully listed in the appendix. The Delphi procedure is systematic panels of experts that goes through multiple rounds of decisions to formulate an answer. According to this procedure, we rated this a 7. A procedure for updating the guideline is provided. Since these guidelines have been produced in 2011, they will be fully updated by the SOSORT between 2016 and 2021. If important changes in the practice will intervene before, an update could be decided by the SOSORT board, could be published before that date. This was very clear, so we rated it a 7. The recommendations are specific and unambiguous. The recommendations are clearly labeled and stated in the document, each under their own section. We rated this 7 because it was very organized and each recommendation is specifically detailed. There are many different approaches given for management of scoliosis. The different approaches included bracing, PSC to prevent scoliosis progression during growth, PSC during brace treatment and surgical therapy, other conservative treatments, respiratory function and exercises, sports activities, and assessment. This guideline included many different approaches for management, and therefore we rated this a 7. The key recommendations are easy to find and understand. They are split by type of recommendation. They are also numbered and clearly labeled. As a result, this is rated 7. The guideline describes all facilitators that helped with the CPG listed in the appendix. However, the barriers against the CPG were not clearly labeled or defined. Therefore, we rated this 3. This guideline used a practical approach scheme, or PAS, to ensure that these recommendations can be used in clinical practice. We rated this a 7 because we really were impressed how the PAS provided different measures in transitioning evidence into clinical practice. The potential resource implications of applying the recommendations have been considered. The guideline was produced and assumed that each recommendation should have in mind the clinical everyday world, balancing all typical factors involved in this decision, including patients, professionals, and social. It reports a real everyday approach since all clinicians usually chosen from quite a wide panel of choices when treating a single patient. We rated this 7 because this guideline did a good job in thinking about clinical practice implications. This guideline provides auditing by inviting researchers to join this effort and clinicians to develop good research strategies to allow the collection of useful data and new evidence. We rated this 6 because it states there's an opportunity for auditing and monitoring, but does specifically list different methods and implications for it. The views of the funding body have not influenced the CPG. There has been no funding for this project and has been developed on a voluntary basis by the commission member. This was rated 7 because it is specifically stated in the acknowledgement section of this guideline. This CPG clearly states all group members that have competing interests of guideline development and is easily found in the competing interests section. As a result, we rated this 7. The overall quality of this guideline is a 6. We found this CPG very informative, straightforward, and well researched. We would recommend this clinical practice guideline to be used in the clinical treatment for scoliosis. The information of the agreed to score sheet is listed in the description below. So I know what you're thinking. You're probably asking yourself, so, Jared, who cares about this information? How does this even apply to my own nursing practice?
Well, Jared, there are many possible implications that we can apply to our own nursing practice.
Like what?
Oh, you know, the age, weight, height, and BMI of adolescents should be consistently recorded during pediatric examination. Examination of posture and gait of adolescents, noting asymmetries of the shoulders and iliac crests and the presence of lumbar lordosis or thoracic kyphosis is also important. Examination should be in an upright position and with a slight straightening of their back. Also confirm suspected asymmetry with a scoliometer at forward and a bent position. And also perform a neurological examination. A thorough systematic review is also important to address atypical curves and other clinical signs like café au lait. Encourage patient to maintain a healthy weight because increased weight can be a cause of ineffective treatment with the use of braces. Clinical practice guidelines for all professionals include evidence for conservative treatment of idiopathic scoliosis. Teach the patient the importance of scoliosis treatment. When scoliosis is left untreated, it may lead to severe trunk deformities, limitation of capacity and functional biomechanics of the chest, exercise capacity, and general fitness and ability to work. Furthermore, it can impair the quality of life of the patient. Teach the patient the treatment goals for scoliosis, including to stop curve progression at puberty, to prevent or treat respiratory dysfunction, to prevent or treat spinal pain syndromes, and to improve aesthetics via postural correction. It is also important as a nurse to assist with educating the patient about CTIS options. CTIS should not overtreat or undertreat. Teach the patient information pertaining to physiotherapeutic specific exercises, special inpatient rehabilitation, and bracing, if indicated by the physician. If the patient is prescribed a nighttime rigid brace, the patient should be instructed to wear it 8 to 12 hours per day and mainly in bed. A part-time rigid brace should be worn 12 to 20 hours per day and mainly outside school and in bed. And a full-time rigid brace should be worn 20 to 24 hours per day and at school, home, and in bed. If exercises or respiratory training is prescribed, the nurse should help in educating the patient according to the physician's prescription. Education, psychotherapy, systematic monitoring of outcomes, assessment of patient's cooperation, and verification and modification of methods in therapy are all useful in CTIS. Therefore, the nurse needs to work as part of an interdisciplinary therapeutic treatment team. This concludes our presentation. Thank you.
Thank you.
From all of us to you, from EBP Group 1.